Small newborns who are admitted to the newborn care unit often require multiple clinical procedures, most of which can be performed in skin-to-skin position. This video demonstrates some of the routine procedures performed in small and sick newborns. Temperature monitoring in KMC position. Small and sick babies are at risk of low temperature, even in KMC. Temperature should be recorded at 4 to 6 hourly intervals. Perform hand hygiene and gather a digital thermometer and alcohol swab. Clean the thermometer from tip to base with the alcohol swab and turn it on. Counsel the mother or caregiver describing the procedure to be done. Uncover one arm of the baby, keeping the baby in the KMC position. Place the thermometer tip high in the armpit, parallel to the chest, and gently press the arm to ensure contact. Wait for the beep, then remove the thermometer and note the temperature. Cover the baby again, perform hand hygiene, and record the temperature in the chart. Orogastric tube insertion in KMC position. Small and sick newborns unable to breastfeed, or take cup feeds, need expressed breast milk delivered via orogastric tube, until they are able to feed orally. Counsel the caregiver, describing the procedure to be done. Perform hand hygiene, and gather all supplies for orogastric tube insertion and fixation. With the head in a neutral position, determine the length of tube to be inserted by measuring the distance from the nose to the earlobe, then to a point halfway between the xiphoid process and the umbilicus. Mark the tube at the corresponding centimeter to indicate the correct insertion length. Gently insert the orogastric tube into the mouth, advancing it carefully until it reaches the marked point. To confirm correct tube placement, gently inject 0.5 milliliters of air into the tube, while auscultating the baby's stomach, for the sound of the air. Secure the tube in place, using skin-friendly adhesive tape on the side of the face. Always check the position of the tube before every feed of the baby. Here you can see caregiver giving tube feeds. Heel prick procedure in KMC position. Here we demonstrate heel prick or capillary blood sampling procedure for glucose monitoring. It is also used for various other tests in small and sick newborns. Perform hand hygiene and gather all the items needed for glucose monitoring. Clean gloves, clean tray, lancet or small needle, alcohol swab, glucometer and strip. Counsel the mother and administer 2 milliliters of breast milk to ensure pain relief before performing the heel prick. Without removing the baby from the KMC position, gently expose one heel. Clean the sides of the heel with alcohol. Perform heel prick using a lancet on the most medial or most lateral edges of the plantar surface of the heel. Do not squeeze the heel, allow the drop to collect for glucose measurement. Perform hand hygiene and document the glucose reading in the baby's monitoring chart. Venipuncture and IV line insertion. Many small and sick newborns may require peripheral intravenous catheters for administering fluids and medications. Perform hand hygiene and gather all supplies needed for intravenous cannula insertion and fixation. Counsel the mother, and administer 2 milliliters of expressed breast milk to the baby for pain relief before the procedure. Choose a site with a relatively straight vein, ensuring asepsis is maintained throughout the procedure. Clean the site gently yet thoroughly with an antiseptic solution, and allow it to dry before inserting the cannula. Insert cannula smoothly into the vein and remove the stylet. Gently inject normal saline. Tape intravenous cannula securely. Site of insertion should be clearly visible. A splint can be used to stabilize the joint if needed. Venipuncture should follow the same steps outlined above. Counsel the mother and ensure adequate pain relief before the procedure. Maintain asepsis throughout, and ensure hemostasis is achieved afterward. Other procedures such as providing phototherapy, retinopathy of prematurity screening, can also be done with the baby in skin-to-skin contact with the mother, without separating them.